Hello, everyone. Welcome back to Neurospicy Nursing. Today's lecture is going to be going over PKU and NEC, and it's everything that you guys are going to need to know for testing purposes, as well as if you have a question for the NCLEX. All right, so to get started, we're going to go over PKU. We're going over what is it, why we screen for it, how do we explain it to our parents, diet basics, as well as the nursing priorities. So, what is PKU? It is a metabolic disorder that basically says, hey, I can't make my own enzymes. It's a genetic and lifelong disorder, and it's totally manageable if we catch it early. PKU stands for phytoketonuria, and basically the whole deal is the babies, again, they're missing the enzymes that the specific enzyme is phenylalanine hydrolase. You guys know I can't pronounce stuff, so just, bear with me. But it's an enzyme that breaks down phenylalanine. Without this enzyme, phenylalanine is gonna build up. You guys know I'm gonna struggle so bad. It's gonna build up, and when it builds up, it ends up becoming toxic to the brain. So if you think of PKU as please keep it under control, that might help you guys. So PKU, P for please, K for keep, it, and then U for under control, because that's really what we're trying to do here is keep that phenylalanine under control. So why we screen for it? Again, it's important to catch it early. We're going to screen every newborn for PKU because early detection literally prevents brain damage. It's one of those disorders where we're gonna screen the newborn because that screening process is the hero of the story. It helps prevent that long-term brain damage. All right, so how do we explain to the parents? Like always, we're keeping it simple, calm. We are going to say something like your baby can't break down a certain protein in their body, so we keep them safe by controlling how much of that protein that they get. Then we're going to pause. We're going to let them process this because this is being done about 48 hours postpartum, and emotions are still really, really high. It's a lot to process 48 hours postpartum. So we're going to end up giving them reassurance, but not false hope. And they need honesty. They need clarity, and they need to hear what the plan is for their baby. Okay, so diet basics. It's really the cornerstone and the most important thing about PKU. So breastfeeding is going to be okay, just in moderation. Babies are going to need a very specific formula that's low in phenylalanine. And then as they grow, we're gonna limit how much of certain proteins that they eat, like meat, eggs, and milk. And we're gonna encourage a lot more dietary fiber and vegetables like potatoes, lettuce, peas, and bananas. Our nursing priorities are gonna be regular labs to monitor those levels, monitoring for anemia, teaching the parents to read their nutrition levels because it is important. It is basically a survival skill for their child, and reinforce that this is a lifelong thing. It's not a phase, it's not temporary, and diet management is not negotiable. So, you can also remember that high protein is not for these kids. PKU, again, they basically live on the salad bar at the cafeteria. And PKU is also a marathon. It's not a sprint, and diet is going to be the running shoes for these kids. All right, into NEC. We're again talking about what it is, who's at risk. We're going to go into the assessment red flags, diagnosis, nursing intervention, and how we're going to explain this to our parents. So, all in all, NEC is exactly what it sounds like. The gut is going to get inflamed, it's going to lose blood flow, and the tissue is going to start dying off. It is a medical emergency. You will never forget the first NEC baby that you guys are going to take care of because it is kind of scary. Um, it's very, very intense. So, who's at risk? Premature infants, formula-fed babies, babies who have had hypoxia, babies who have infection, basically any baby who is fragile or they have a stressed out gut is a risk factor for NEC. Another thing that might help is if you remember, the gut is dramatic. We all know our guts are dramatic. They get stressed out with if we're stressed, we get like stomach cramps and stuff like that. You guys have all heard of IBS. But if you have a stressed out gut, NEC is going to be the plot twist for that. It's something that changes it completely. That's why it's a medical emergency. So make sure that you guys keep that in mind. All right, so assessment red flags. These are things that we cannot ignore, especially if you see a combination of these things, you're screening for NEC, okay? Abdominal distension, increased gastric residuals, bloody stool, periods of apnea, hypotension, lethargy, poor feeding, or decreased urine output. You're looking at all of these. If they have multiple, you are absolutely, definitely screening for NEC. All right, so diagnostic procedures, it's pretty simple, but it's usually going to be confirmed with blood work and an abdominal x-ray. You're looking for pneumatosis, which is basically a pocket of air in the bowel wall. If you see that, it's basically NEC, unless that they can prove that it's not NEC and something else is causing the air in the bowel wall. All right, so nursing interventions, here's what we're gonna do. They are MPO immediately because they need bowel rest. We're gonna give them fluids and TPN for nutrition because we can't just not give them food. They're in a critical time in their life. Food is very important, so they still need some sort of nutrition. NG and OG tubes are going to be for decompression. Obviously, if it's a smaller infant, we may end up doing an OG just because of the size of the nair. Also, you're going to see IV antibiotics. If we know that they're going to be on long-term TPN or long-term antibiotics, there is the possibility of a central line. We're also going to make sure that we're measuring the abdominal girth every 4 hours. We're still going to support bonding with mom and dad. They should still pick them up, do skin to skin, um, and just, treat them like a baby, regardless of what they have going on. Just be careful for with all the lines and tubes and stuff like that, but they should be holding their baby, caressing their baby, and bonding with their baby. And then we're also going to support the caregivers for the possibility of the baby needing surgery. Because again, you're finding out that your baby has NEC about 48 hours after you just gave birth. That is stressful. So support, especially for the mom, is going to be super duper intense, and very, very necessary. You can also remember NEC as for the interventions as not eating clearly because the first thing that you have to do is make sure that you make the baby NPO. All right, so a parent-friendly explanation. Just one more time. We're talking to the parents, we're being gentle, we're being clear. 48 hours after birth, okay? Stressful time. And we're just gonna make it simple, right? It doesn't matter if they've been a nurse for 10 years, 20 years, whatever. Simple words are the most important. We're gonna tell them your baby's intestines are inflamed and it needs total rest. We're gonna support them while the gut heals. Parents don't need the patho-phys. They need a plan and they need reassurance. And they need to know that we are acting quickly and efficiently, obviously to the best of our abilities. All right, so that's everything PKU and NEC. Obviously, two very different conditions, but they both require early recognition, clear communication, and some pretty intense nursing interventions. But that's all. Here's our resources. And thank you guys. I will see you in the next one. And yeah, look for those secondary sex characteristic videos, and then you'll see a genetics video coming out today, and there should also be a pediatric emergency video coming out soon. But yeah, thank you guys, and have a great day. Bye.